Good morning. Today we will discuss about viral lesions of oral cavity. Contents include introduction, classification, herpes virus infection, herpes simplex virus infection, varicella, herpes zoster, infectious mononucleosis, cytomegalic inclusion disease, focal epithelial hypoplasia, enterovirus infections, herpangina, and foot and mouth disease, acute lymphonodular pharyngitis, measles, mumps, HIV, conclusion and references. To start with, viruses are small microorganisms and vary in diameter from 20 to 200 nanometer. They are obligatory intercellular parasites which coat the host cells by contributing its own nucleic acid to produce a generation of virions. A virus consists of a central core of either RNA or DNA, which are surrounded by a shell or capsid made up of polypeptides. Some viruses, an outer envelope is present composed of glycoprotein derived from the host cell membrane. When a virus comes in contact with a susceptible cell, it adsorbs onto the cell at the specific receptor sites, which determine its susceptibility of the cell to particular virus. The virus penetrates the cell by a process of pinocytosis. The lipid envelope and protein capsid gets stripped off to release only naked viral nucleic acid. This nucleic acid gets incorporated in host DNA, which will now code for viral products. During the phase of release, the viral particles are extruded from the cell and are covered by an envelope derived from either cell or a nuclear membrane. Adjacent cells get infected by direct transfer of virions, while other cells get infected via intracellular substances. Virion is a complete functional virus that has the capacity to infect living tissue. It includes the genetic material, either RNA or DNA, capsid, envelope, and membrane proteins. Spread of virus in the body, first studied by Fenner using mousepox experimental. When the virus enters the skin, it multiplies initially and spread to regional nodes through lymphatics. Enters the bloodstream and transported to central foci for viral multiplication. Masses spill over to bloodstream. Prodromal symptoms reach the target multiplication and produces the lesion. Classification. General classification of virus pathogenic to human are DNA and RNA. Under DNA, it includes parvovirus, papovirus, adenovirus, herpes virus, pox virus, and hepatinovirus. Under RNA, picornavirus, reovirus, togavirus, orthomyxovirus, paramyxovirus, rhabdovirus, arenavirus, coronavirus, and retrovirus. Significance of incubation period. It represents the time taken for the virus to spread from the site of entry to the organ of multiplication to the target organs for the production of the lesions. It is influenced by the relation between the sites of entry, multiplication, and lesion. When the site of entry and site of lesion are same, shorter incubation period, that is 1 to 3 days, are required. When the virus enters through respiratory tract, produces the lesion in remote sites, so longer incubations are required. Herpes virus infection. This family comprises about 50 different members. Man is the host and exclusive reservoir of 4 members of this group. Herpes virus simplex type 1 and type 2, varicella zoster virus, Epstein-Barr virus, cytomegalovirus. Herpes virus are known for the capacity to establish persistent infection. After their multiplication in the epithelial cells at the site of infection, the virus spreads along the sensory nerve to the ganglia. Virus induces a productive infection in the ganglia and later establishes a state of latency. The sensory ganglion is the typical site for both HSV and varicella zoster virus, while the cytomegalovirus and Epstein-Barr viruses establish themselves in lymphoid cells. Herpes simplex virus. 2 types of herpes simplex virus are similar structurally but different antigenically. HSV1 is adapted best and performs more efficiently in oral, facial, and ocular areas. It spreads predominantly through infected saliva. The pharynx, the intraoral sites, lips, eyes, and skin above the waist is involved most frequently. HSV2 is adapted best to genital zones, involves genitalia and skin below the waist. Transmitted predominantly through sexual contacts. Features of herpes simplex virus 1 are encephalitis, conjunctivitis, gingival stomatitis, tonsillitis and labialis, pharyngitis, esophagitis, herpes gladiatorum, genital herpes and herpetic whitlow. HSV2, meningitis, pharyngitis, perianal herpes, genital herpes, herpetic whitlow. Triggering factors include fever, UV light exposure, common cold, emotional stress, fatigue, trauma, oral cancer therapy, immunosuppression, oral and facial surgery, viral infections, gastrointestinal upset, pregnancy, and menstruation. It commonly occurs at a young age, often asymptomatic and usually does not cause morbidity. With HSV1, the trigeminal ganglion is involved and the virus remain latent at its sites. The viruses are usually sensory neurons to travel back and forth to the skin or mucosa. Recurrent or secondary HSV1 infection occurs with reactivation of virus. Numerous conditions like old age, ultraviolet, emotional stress, pregnancy, allergy, trauma, respiratory illness, menstruation, systemic illness, or malignancy have been implicated as reactivating factors. Acute herpetic gingivostomatitis, most common pattern of symptomatic primary herpes simplex virus infections. Incidence of HSV1 increases after the 6 months of age. Peak of incidence is during 2 to 3 years of age. Does not increase until sexual activity begins. Clinical features. Many primary infections are subclinical. Symptomatic disease preceded by prodromal fever period, headache, malaise, nausea, and vomiting. Within a few days, the mouth becomes painful and the gingiva gets inflamed, that is erythematous and edematous. The lips, tongue, buccal mucosa, palate, pharynx, and tonsils may also be involved. These initial lesions enlarge slightly and develop central area of ulceration, which are covered by yellow fibrin. Adjacent ulceration may coalesce to form larger, shallow, irregular ulceration. Mild cases usually resolve within 5 to 7 days. Severe cases may extend up to 2 weeks. Recurrent herpetic infection usually involves herpes labialis. Prodromal signs and symptoms include pain, burning, itching, and tingling sensations, localized warmth, erythema of the involved epithelium, arise 6 to 24 hours before the lesions develop. It occurs as multiple small vesicles, papules develop from clusters of fluids. You can see the picture of the papule development. First, initially, it will be multiple small erythematous papules. It gets changed into cluster of fluid-filled vesicles, and the vesicle rupture and crust within 2 days. Herpetic whitlow, infection of the thumbs or digits as a result of inoculation in children with orofacial herpes. Recurrences on the digit are usually not unusual and may result in paresthesia and permanent scarring. Management, infections are usually treated with palliative care. Symptomatic and milder patients are managed by supportive care, includes maintenance of fluid, acetaminophen to reduce fever, and use of topical anesthetics like lidocaine, milk of magnesia. Acyclovir is a good standard prophylactic treatment of HSV infection. Recurrent herpetic lesions are usually treated with topical antiviral medications. Topical peniciclovir reduces the duration of pain and recurrent lesions by 1 to 2 days. Patients are recommended to apply topical peniciclovir over the affected site every 2 to 4 days while awake. Topically, acyclovir is also recommended in recurrent herpes infection and is usually effective when the lesions commence during prodromal symptoms.